Today we're going to be talking about some of the neural adaptations that come along with exercise. So just a little background information of the neural adaptations to exercise. It is basically the brain and the nervous system's way of producing a particular movement and to do that movement as efficient as possible. These adaptations are primarily seen during strength training or resistance training. However, they can also occur during consistent aerobic training as well. These neural adaptations are the reason for what we call beginner gains when you're talking about strength training. These changes typically affect someone up to the first 6 weeks of training, and then after that, changes such as muscular hypertrophy, tendon strength, that sort of thing follow along. Um, this is the reason that someone new in the gym, compared to someone who's already been lifting for a longer period of time, may see greater progress at first. So let's say you have two people equal weight. One has been lifting for 6 months, one is just now starting to lift. These neural adaptations that occur in the beginner lifter may be the reason why his bench press goes up 50 pounds within 6 weeks, and the one who's been lifting longer may only go up 10 pounds or so.
So next thing we're going to talk about with neural adaptations is going to be neural adaptations with resistance training. So as we learned before, like in classes like biomechanics, you see really fast improvements in a non-active individual within the first 6 weeks of strength training, and that's due to the motor units, motor neurons being activated, being able to fire efficiently now. Because if they're not being used, then they start disappearing. So when you're young, your neurons will be dormant until you begin to use them. So as I said before, the motor neurons, and then if they're not used, they will disappear as you age. So it's the whole use it or lose it mentality that is said in exercise so often. So as you train at higher and higher intensities, they continue to improve, but not as extreme like the beginner gains that you get in the first 6 weeks. So strength training to improve slash retain. Resistance training helps to reduce motor neuron loss during aging. So like I said before, use it or lose it. Aging is characterized by a loss of spinal motor neurons, and that's from our third reference. And if you lose a neuron, you cannot get it back. Leads to losses in cognitive function, muscle mass, fine motor skills, and things like that. That's why you see people in physical therapy, they can't move as well as they used to, no matter what. Even if they were an elite athlete when they were younger, if they stop exercising, you just lose it. And resistance training has also been proven to improve and help keep fine and gross motor skills in older adults.
So this study actually was looking at the autonomic nervous system responses to strength training in top level weightlifters. These lifters consisted of 9 subjects, which is one of the big limitations that they actually had. 5 of which were male, 4 were female. They were Italian weightlifters. They were preparing for the European Championships and then eventually hoping to become Olympic athletes to compete in the 2016 Games. These subjects trained 3 days or 3 sessions per day, 6 days a week, and the intensity ranged anywhere from 70% to 95% of their 1 rep max. They were studying the relationship between their overall training load and the autonomic nervous system parameters. And something that they discussed in the beginning of the study is that the heart rate variability of each subject was shown to be capable of detecting adaptational changes in the sympathovagal control attending physical training. So what were the actual findings of this study? So the bottom left picture there is just the training load along with the months of their total training. So baseline 2 months, 4 months, and the tapering period. As you see, 4 months saw the highest training load. The picture in the bottom right hand quarter there, this is the RR interval that they were looking at on an EKG. And then LF is low frequency, HF high frequency, and then the bottom right little graph is just the RR interval. As you can see, with the low frequency as well as the low and high frequency together, they were reaching their maximum around that 75% of their load. So just in between the 2 month and 4 month period. And then on the bottom, they're just taking a look at the high frequency and the RR interval alone. Those saw the biggest changes near their maximal at that 95% that was discussed in the previous slide. So what they actually concluded here is that the ANS adaptations to strength training are dose related on an individual basis. So depending on how they actually dose their total load, that's when they started to see the overall changes. Different ANS adaptations to those who endurance train shift towards parasympathetic nervous system predominance as load reach maximum. Again, that's what you're seeing at the two most bottom right graphs, the RR of the high frequency and just the RR interval. And then the last thing is that in these top level athletes, the ANS adaptations are sport specific and not generalized. So this solely has to do with the actual sport that they're competing in. It's not a total bigger picture, you could say.
So to summarize one of our references, this is the role of the nervous system in atrophy with aging. So if you look on the graph on the left, this is a young male subject, 28 years old. And that little picture there kind of shows all their muscle fibers. And then underneath it is an older male subject. So you can already see a difference there. All right. And then if we look on the right side, we have a 60-year-old woman versus an 80-year-old woman. And you can see the atrophy going on there. A lot of fat mass being accrued in the 80-year-old woman. And then if we look at the graph at the bottom right, we can see the total number of muscle fibers. And as the age goes past 20, 30 years old, you start to lose your muscle fibers. And that's due to the motor neurons not being activated and not using those muscle fibers, which then leads to you to lose it. So with the loss of the motor neurons, muscles will no longer be excitable, right? So they won't be able to get activated through electrical stimulus. And so, yeah, it means the muscle won't be used, muscle will atrophy, and another term for that is sarcopenia. And once again, you use it or you lose it.
In neural adaptations with motor skills and strength training, they took 24 healthy volunteers and they split them up into 3 different groups. The first group being 8 of them going through testing procedures with no training whatsoever. Second group being strength training only for 4 weeks, and they were testing out the 1 rep max with dynamic and isometric bicep curl. Last group was the last 8 volunteers going through visual-motor skill learning for 4 weeks, and they were testing out the motor skills training on the right elbow flexors. You can see on the picture to the left that they used a purpose-built computer to measure the position of the elbow joint, and you can see that there are 2 links connected to each the bicep and the triceps, and the volunteers holding another sensor to measure the response to the positioning of the elbow. So the results of this study came out as expected. For the strength group, the dynamic and isometric maximal strength for the bicep curl increased by 31.2%. And as with the control group and the motor skill group, the results remained the same for maximal strength. And you can see the results on the left. Now for the graph on the right, this is measuring motor performance mean error. And as the weeks went on, you can see that the error went down, which results in motor skill performance going up. So it's well shown now that neural adaptations are present with training for specific functions.